No medicine can remove the cause of a lifestyle disease, but you can.
Fatty liver means simply accumulation of fat in the hepatic cell. At the cellular level, fat is accumulating. In the early stage, you just see that the abdominal circumference, and if it is increasing and it is protruding, reduce the weight and see that you are going to low normal BMI and check the ultrasound scan, because ultrasound scan is not harmful. It is not like a CT scan or MRI. So it is cheap, it is very economical. And in the third one, 90 days scan, actually his liver size is reduced. So he was worrying, which is any problem actually. So whether it is actually in the third, that is because of the fat content is reducing, the liver size will reduce. Lifestyle correction means every individual has an understanding about lifestyle, correct lifestyle. Some may be thinking that their lifestyle is not correct and they'll try to do some exercise and reduce on calorie and all.
Welcome to Lifestyle Disease Doctor. Here we bring you evidence-based conversations on various chronic lifestyle diseases. Today's topic is liver disease and fatty liver disease. Basically, we have divided it into 4 parts so that it is easier to absorb for those who are keen on it. In the first part, we look at the nature and cause of liver disease, especially fatty liver disease. In the next part, we look at various treatments available at present in these fields. In the third part, we look at the various comorbidities and complications associated with liver disease and fatty liver disease. And in the fourth and final part, we see how clinically supported lifestyle correction can play a major role in treating these diseases. With us, we have today Dr. Jolly Thomson, who has extensive experience in treating patients with chronic lifestyle diseases like liver disease and fatty liver. The first question to Dr. Jolly is, what are the various liver diseases?
Liver disease mainly of 2 types. One is acute and then the other is chronic. Acute means the disease has a fast progression and the patient will get a symptomatic within a few days or even within weeks. And in chronic type, it is slowly progressing and the patient will not knowing about it for a long time, maybe years, 10 or 15 or 20 years, there will not be any symptoms. Only we will be able to find out it by the testing. The modern diagnostic test we will be able to find out. In the acute, most common is viral infections. Actually, infections can give an acute liver problem, or with drugs, some antibiotics or chemotherapeutic agent. Even some patients, it can create liver failure within a month or very fast. So that is why when we give medication, especially liver toxic medicines, we'll check the liver function test even every week in the initial stage. When it comes to chronic disease, it is the one is we all know that alcoholic liver disease, and next is non-alcoholic liver disease and non-alcoholic non-alcoholic hepatitis, NASH actually. And it can progress to fibrosis and then cirrhosis and then to liver failure or even carcinoma of the hepatocellular carcinoma.
When we talk about fatty liver, it seems to affect almost 1 in 4 adults world over. Yet, people generally feel that, fatty liver is something very light, because initially, everyone says, oh, it's okay, you can manage it and all that. What exactly is fatty liver and what should patients know when they get a diagnosis of fatty liver?
Fatty liver means simply accumulation of fat in the hepatic cell. At the cellular level, fat is accumulating. While fat is accumulating, the liver is not able to handle the fat coming into the liver. That is what we are eating. It is from the intestine, it is directly absorbed into the blood and coming into the portal circulation. That is, it is going into the liver and it gives the whole food you are eaten, it is absorbed and it is given to the liver for processing. But the liver is not able to process it, or the carbohydrate, if you have taken excess, it will be converted to fat by the liver, but it cannot give and send it for storage. The storage will be full, or the fat or it is not able to process it into energy form or other products like whatever is like cholesterol and all is made from actually from the fat itself. So such a production is blocked when the fat will accumulate, that is creating problem for it and the cells, and then it will, if it is accumulation is too much is there, then it is hepatitis, the cell itself will get damaged. That is a major problem actually in the fatty liver. In the initial stage, there will be only micro vesicles or micro level accumulation, but when it is going to stage 2 and stage 3, etc., the cell damage, and that is leading to the fibrosis and cirrhosis and liver failure, etc.
You often say that, in our body's organs, they are supposedly so prepared that, up to around 70 or 80% damage they can sustain and, give a feeling of being normal. So in the case of this liver also, the same problem seems to happen, that lot of damage can be sustained by the liver, and the person thinks that everything is normal. So what is the way in which patients can be made aware that, that if they continue in this way, within a couple of years they can face serious problems?
Basically, liver forgives a lot. And if it is this fatty liver and this chronic problems, it will continue. You will not be symptomatic at all. You will not be feeling, we may be feeling a little tiredness in the initial stage. But actually, there will not be in stage 1 or stage 2 fatty liver if there is no other disease. There will not be any problem actually. Only if you have diabetes or hypertension, and along with that, if you are taking so many medicines, then you may feel abdominal discomfort or abdominal pain and all may start. Otherwise, it will not show any symptoms. And if you are not looking for the blood test, routine health checkup only, you will be able to find out there is a fatty liver or the liver is shrinking. So what we have to do, you should look for it. And the end stage, when the end stage comes, you may get edema or the ascites can occur, or with portal hypertension. Portal hypertension means inside the liver there is a circulation. Actually, generally we call hypertension is the systemic circulation. We have other two circulation. One is the liver circulation specific for the liver, that is called portal circulation. And if the pressure increases in that, there will be varicose veins inside the esophagus, inside our food pipe, and it can break and bleed. And that is it. That is the end stage. The patient comes with vomiting blood. Just like the leg varicose veins rupture, it can also rupture, and then that is actually we call it vomiting blood, and then that stage only some patients will be aware of their problem. But we can find out all this very early stage itself actually, with if you are looking for it.
If that is so, all patients would like to know what are the major risk factors that they should be aware of, so that they can actually prevent this situation.
Everyone knows that the alcohol intake. Alcoholic damage the fatty liver, and then goes to alcoholic hepatitis, fibrosis, cirrhosis, and failure or cancer. The next is the non-alcoholic fatty liver and liver damage. Actually, alcohol is a carbohydrate, just like the other our rice and wheat and the regular food. So if the carbohydrate content is excess, that also, if you are eating too much of carbohydrate, it will be converted to fat by the liver, and it will be sent for storage in the adipose tissue, that is the fat cells inside the abdomen and also the subcutaneous area. And actually everywhere there is a fat deposit. Every artery and nerve is covered, and the passage is through the fat actually. That is a protective cover will be there everywhere. So this will be get accumulated and it is be overcrowded. If there is a limited, fat cells are limited in our body and it can expand just like our tummy is expanding. That is, when you are seeing an expanded tummy, your belly is protruding. That means there will be definitely you will be having fatty liver also, because the excess fat in your body, it will be trying to find out deposition in different places, and if there is a tummy, protruding tummy, you will be having a fatty liver, and also you will be having atherosclerosis. Your blood vessels will be get blocked with this. That is actually this. We are doing the stent for the heart, coronary artery, and all, because of the fat accumulation, which is creating problem and block. This will be happening. This all actually is a parallel thing. So it is called metabolic syndrome. Actually, this it's a fatty liver also is a part of the metabolic syndrome. Obesity, hypertension, diabetes, and dyslipidemia. The triglyceride and cholesterol will also go high. So another important factor in this is insulin resistance. When the fat is accumulating, excess fat is there, the insulin level will rise, because the insulin is the component which is actually has to put the fat into storage and for the energy use. And if you are not doing, you are eating more and not doing physical activity, then it has to go for storage. When the adipose cells are filled with fat, the adipose cell says no. Then the pancreas will try to secrete more insulin, and that is the reason for hyperinsulinemia. Hyperinsulinemia, when the insulin level is going high, you will get hypertension, because the insulin will has a nature to sodium retention will be there. You all know that for the hypertension, the reason is sodium. We will advise the patient first is reduce your salt. So actually the insulin will, hyperinsulinemia of type 2 diabetes will give hypertension also. And there is excess fat in the liver cells and in the blood also. That is actually this triglyceride and dyslipidemia. It is because of this excess fat. There is no place to deposit, so it will be circulating in the blood. That is that we call it is a triglycerides is high and the cholesterol is high, etc.
You have been able to connect this issue of insulin, that is basically diabetes with high insulin and in the body. That is usually the situation where people are most probably taking insulin injections also. And also you linked it with their cardiovascular health also, obesity and all that, hypertension, etc. Now, what we hear and see is many thin people also face the problem of fatty liver. What is it that you have to tell them? Because they say that we are thin, we don't have any fat, but we see surprisingly fatty liver in our body.
In that, two aspects are there. One is, even if they are lean, they will be having a protruding tummy. That means there is excess fat. The weight will be low or normal weight or underweight. Even underweight people also having I have seen many patients like that. So excess fat, even though their problem is their muscle and bone is not reduced. The fat is reasonably there. So one aspect is that. Next, for the underweight people having a fatty liver is because of the nutritional deficiency. See, using the fat or even the storage of the fat, we need certain vitamins and special minerals and all is needed. And if there is a deficiency, it can go for the liver damage. And that is actually many of the crash diet people, if they don't take, they will be using a low calorie diet along with that nutrition, essential nutrition will be deficient. So the liver will not be able to process it, and there will be liver damage, cells will be damaged. So one of the most important vitamin for this, actually, the concern of the liver is the choline. Actually, we are not counted choline as a vitamin till recently, actually. And it is not supplemented also in the regular multivitamin tablets and all. Even now, there is not much of the choline vitamin is not available. Actually, it has a very important role in this protein synthesis and also in DNA synthesis and even the genetic cell division and all. It has a very crucial role. Just like folic acid, all the pregnant women, we supplement with the folic acid. No? So for this neurological damage and all, to prevent the neural tube defect in children and the congenital anomalies in children, we supplement with the folic acid. So actually, this choline also has equal role in that. And for the liver, this choline is also very, very important role. If there is not, and some of the studies are showing that congenital anomaly also, just like folic acid, this choline also is important. And liver problems, many of the liver problems, especially the pregnant women, severe liver disease can occur. In that case, especially with the PAH, hypertension, pregnancy-induced hypertension and all. So there also has a major role of the choline deficiency also is there. Actually, in India, we don't have much studies about the deficiency, but I have seen many of the American studies where how much of American people are, many of them are deficient actually in the choline. I think that actually the dietary recommendation for Americans, they have clearly mentioned that choline deficiency and all.
Most people don't realize the importance of the liver in actually what food they take, because generally speaking, it is heard that liver has a very major role in almost all foods that we consume in handling it and all. Can you shed some light on the importance of the liver so that people who, when they take food, they should realize, this food is not only being managed by my digestive system, but that digestive system, the liver's role in that is so important. So that, they will be more careful when they put something into their mouth.
Basically, actually, liver is a part of the digestive system also. Liver is actually producer of so many proteins. Almost 500 items are continuously produced in the liver, and it is according to the need of the body it is producing. And also along with that, the liver is producing digestive juice called bile. Bile is then stored into the gallbladder. And actually, this gallbladder disease, we have always hearing about the gallbladder stone, gallbladder polyp, and gallbladder cancer, etc. Actually, when the liver is diseased, the gallbladder also get diseased. Actually, the gallbladder function is to store the digestive juice produced by the liver, and then when the food is we are taking the food, it will be released. But if the composition of this digestive juice stored in the gallbladder, if it is abnormal, if it get abnormal because of the liver is not well, so that will damage the give disease to the gallbladder also. But for the gallbladder disease, polyp or the stones, we simply ignore it, the problem with the liver, and we just remove it. In the modern medicine, the gallbladder problem, remove the gallbladder. That is the easiest way out. That is, we are always thinking in that way. But it is not correct. If you remove the gallbladder also, there will be so much of problem, and the liver problems will be continuing. So this digestive juice, along with that, this digestive juice, the excretory product also. When the major of this, whatever we take, even these vitamins and this drugs, this liver first pass metabolism is there. Almost all the drugs which we are taking over the mouth, 90% will be destroyed in the first pass metabolism itself. And that metabolic waste also is coming into the along with the bile and into going into the intestine for the as an excreta. So liver role is very, very important for human. Not all the vertebrates have liver. So if the liver is damaged, that processing of the food and also the digestion can get affected.
You had mentioned earlier about the connection between the liver functioning and the other body parameters like hypertension and dyslipidemia, fat content and all that. So when you look at it, when normally a patient comes to the hospital, usually we see that they don't come initially for a fatty liver diagnosis. They come for something else. So now what is happening is that they come for multiple other issues, and then fatty liver is diagnosed on the side. So once that is diagnosed, usually the patients have a feeling, that that is something that can be managed on the side of it. While they had come for the major issue, must have been diabetes or cardiac problem or kidney problem or whatever. So why is it that, in our present context, this fatty liver is not taken seriously? Is it something that, the patients should be made aware of?
Yes, definitely. Because the modern medicine, I'm talking mainly about the modern medicine. I'm not aware of much of about the Ayurveda and other alternative medicines. In modern medicine, there's no medication actually for the liver problem, fatty liver, or the cirrhosis and all. Only thing what we can do is our only medicine which is given is bile salt supplement, supplementary bile salt. I had told you that this bile, the digestive juice is there. In a part of the digestive juice, it can be supplemented. As we know, if your thyroid hormone is deficient, we can take supplement. Just like that, if the liver is having a problem, you can take bile salt as a supplement. But no other medicine. Liver is not producing bile salt alone. Liver is producing around 500 items. So only one is this bile salt. So we have only that one item. So what we have to take care is, there is no medicine can reverse the fatty liver, but it's the lifestyle, especially excess calorie, excess carbohydrate, excess fat intake, and excess fat accumulated in the body, which can be removed only by burning it out. It's basically the fat is carbohydrate, hydrocarbon actually fat. This accumulated fat is only carbon and hydrogen. It has to be used and converted into carbon dioxide and water. Then only it can go out. For that, first thing, we have to reduce the calorie. Then only this excess calorie can be. It's only calorie actually. This fat is in the body mainly for excess fat. But fat has many functions, even protection of the body and giving shape to the body and all is there. But excess fat comes is accumulating because of excess intake and too much of energy, lack of exercise. So that has to be, you have to cut the carbohydrate and the fat and the excess calorie, and the excess which is stored has to be burnt out, simply burnt out. Actually, it has to be made into carbohydrate, it's carbon dioxide and water. And that is the only way out for that. That is not the doctor can do anything for that. Only the patient, the person can do that for that. That is why if you are going for a scan, if you are finding out a fatty liver stage 1, doctors will not even comment about that because they don't have anything to offer for that. If it is stage 2 or 3, usually not even in the 2 stage, bile salt also is supplemented because it is not necessary. In the end stage, cirrhosis, and when you are developing ascites, or when you are getting symptomatic in the end stage of the liver disease, only this bile salt also will be supplemented. So the patient should be aware that if they have a fatty liver at any stage, the only one who can give can help you yourself, and you have to control your food and do the exercise and make sure you are getting all the necessary nutrients also. You don't have to go for a crash diet. When you are using the diet also, you should make sure that you are getting all the nutrients in the correct proportion. Don't take some junk food and make the crash diet. But you can use the this nutrition-rich leafy vegetables and fruits, moderate fruit also in the moderate quantity. Then you will be not to have much of the problem.
From your experience, can you share any example of any patient, and what stage the patient was and how they could manage by correcting their lifestyle?
I have regularly seeing all levels of fatty liver problems. See, fatty liver, no one bother actually. Only it is an incidental finding. Before I'm actually giving clinically supported lifestyle correction, in that before starting the treatment itself, we'll do an abdominal scan. In that, liver is definitely assisted. I have not seen only very rarely I see a patient without fatty liver. Only thing, fatty liver 1, 2, or 3 with fibrosis 4 or fibrosis, the level of fibrosis, which actually matters. So the most important thing or the positive thing is it can be reversed. Simply it can be reversed. If it is the patient is undergoing the clinically supported lifestyle correction, in which we are making sure that the patient is getting all the nutrition and the calorie intake is reduced to around 650 to 700 or 800 kilocalorie per day, the patient will be able to reduce almost 10% of 20% of the body weight in 90 days, that is 3 months. And after 3 months, when we look into repeat, we'll do the repeat scan also. If it's for stage 1, the grade 1 fatty liver, it would be usually gone. If it is grade 2 or 3, it would have at least one level, it will be reduced. And I had seen even patients with the 4th stage with severe cirrhosis. And really, the patient is actually understanding only the intensity, and the doctor will be saying only when that is cirrhosis is reached. Even the cirrhosis with a shrunken liver, it will grow back actually. The liver has the hepatocytes, the liver cells. The importance is actually it can divide and make corrections, and liver can repair itself. So even the 4th stage, we can repair it, and the patient can come back actually and get to a healthy liver health can be regained.
What are the first lines of treatment for liver diseases?
In modern medicine, the liver disease management depends on the cause of it. If it's just a fatty liver, it will not be, one of the cases it will be just a fatty liver. There will be some associated disease also. The fatty liver, and before that there will be either some liver infections like hepatitis A, B, or C, or something like that, or alcohol like nature will be there, or obesity, that is excess calorie, excess fat deposition in the body will be there, or there can be some drug continuously taking and it is some reaction because of this fat accumulation, and liver damage can be there. So first to find out what is the reason for that. If there is only obesity or some excess fat accumulation, and the fat accumulation in the liver, so grade 1 fatty liver only, then it can be managed. Doctors will advise just reduce the calorie, that is carbohydrate and fat, and do some exercise and lose for a few kg, how much is excess fat is there or excess weight is there, reduce that. Then you can do a repeat scanning, and see. Usually the fatty liver is diagnosed, it's an ultrasound scan finding. So you can try for 2-3 months this your own lifestyle correction, and then look for the what is the stage of the liver, fatty liver, and it should make sure that it is reversed. If it is not reversing, or you are feeling tired, or some other problem you are feeling, then it has to be taken seriously. And also, if you are taking some medicine and you are seeing that fatty liver is there, then also you should be very careful, because all the medicines are going into the liver and it will increase the workload. Liver is already sick. If the fatty liver or the cirrhosis or fibrosis is there, the liver is sick, then you are eating all the medicines and it will be actually troubling the liver further. So it is very important that we are taking continuously the chronic medication, is because for the lifestyle diseases only. So liver is getting sick because of your lifestyle disease itself, and also this medication you are taking for the lifestyle disease. So try to come out of the lifestyle disease, and make sure that you are living without medications and without lifestyle disease.
Some patients are prescribed statins or diabetic drugs for their fatty liver. So they generally feel that, that those drugs will take care of their fatty liver. What should they understand?
See, usually given drugs are, one is this statin, that is anti-cholesterol medicine. Next is metformin. Metformin is an insulin sensitizer. And in some of the doctors, this call it deoxy. That is one bile salt. The name is very difficult to pronounce, so I don't want to go into. So one bile salt, that is bile juice, which is secreted by the liver, as a supplement to support the liver. Actually, this bile salt is made by the liver. So when the liver is sick, okay, you give it ready-made bile salt, I'll give, and that is the way it is done. The problem is, when we are taking all this, when you are taking metformin, that is actually a diabetic medication, type 2 diabetic medications to increase the sensitivity, but it doesn't have much of the role for the fatty liver actually. And actually this medicine also is going into the liver, and it has to remove all this, the liver has to metabolize it, just remove it. And thus, when you're taking statin, even more difficult for the liver, because liver is the producer of the cholesterol. Cholesterol is needed for many functions in our body. Cholesterol is needed for the sex hormones, all the sex hormones, testosterone in female, and pregnancy hormones, estrogen, progesterone, even the corticosteroids, that is the mineralocorticosteroids, which is actually controlling the electrolytes balance and the urine production, etc. It is controlled by that. So even the vitamin D production, vitamin D is produced from the cholesterol. Even the cell production, cell wall, the cell membrane is produced, the cholesterol is a major ingredient. And even the brain, cholesterol is major ingredient. So that is why the brain, the cholesterol is very important. That is why many of the patients who are taking the statin get memory problems. Actually, it is very evident for some actually. After taking for 3 or 1 or 2 years, or after, even many report within 2 or 3 months itself, the memory is reducing. They are not able to remember the breakfast, what they're taken, or the phone, who has called, or what I had talked. So if you are feeling that we should taken it very seriously, the cholesterol deficiency, those who are taking statin, otherwise also the memory problems can come. If you are on statin and your memory is failing, you should be thinking about that also. So as such, for the medication has a very limited role only in that. And some diabetic, anti-diabetic medicines also, the newest one of two is saying that it is can be used for this cholesterol and triglyceride also. But I have seen so many prescriptions, the patients with such prescription, but their cholesterol and the triglyceride will be high, and some with the cholesterol, the statin, it will be very low. Diabetes, the cholesterol will be controlled, but the triglyceride will not be controlled. Actually, not the cholesterol. The troublemaker is the triglyceride. Triglyceride is the fat. Actually, cholesterol is a component of the HDL and LDL. That is the transporter. It's actually the fat is transported inside our body, inside through the blood vessel, through with this HDL and lipoproteins in the form of lipoproteins. These lipoproteins can be HDL or LDL, and depending on the content of fat inside, the triglyceride inside that. If too much of triglyceride is there, it will be low density lipoprotein, that is called the bad cholesterol. We take it LDL, bad cholesterol. The HDL, that is good cholesterol, that is with less triglyceride, because we all know that the density of the fat is lower than water. That is why it is floating up. So that is the same situation. It is heavier when there is less fat. So less fat cholesterol, the truck with the less fat is better one, because there can be ample space for taking the fat actually. That is the only difference actually. We should understand that when you are seeing the patient also should have an idea about what is good cholesterol and what is bad cholesterol, LDL, HDL, etc.
See, you were mentioning that the different stages of liver disease and fatty liver, basically the changes are not very much noticed till it is reached a very serious stage. Now, what are the stages as far as a patient is concerned that they should know that that, see, if I am at this stage, this is what I should do. If I am at this second stage, this is what I should do. Anything like that to guide the patients, so that once they know what stage they are in, immediately they will have to take all necessary steps on their own part. Because from what you said, the medications and all those sort of things, they are very limited. There is hardly anything that can be done. So what is it that patient can relate to the stage in which he is?
Everyone should do a yearly scanning to see fatty liver. Actually, many of the Western literature actually, they are saying that 30% having fatty liver or fat or 25%, 30% and all. But in my experience, it should be much higher in our population, at least in Indians, because we know that the Indians have a protruding tummy even by the time they're BMI 23 itself. Generally, the Westerners, this Caucasians, generally 25 BMI is the upper limit. But the people is generally considering the upper limit is the normal. It is not the upper limit. For the health, especially those who are this physically not active, low normal BMI is the ideal. So in Indians, 18 to 23 is ideal. If at any stage, if it is 23, you don't have a protruding tummy and excess fat is not there, it's okay. If you are more muscular, that's no problem. 50% fat or 25 to 15 to 20, up to 25 for the ladies, it's okay. But if it is more than that, we should be careful about. So you will be getting a fatty liver. So in the early stage, you just see that the abdominal circumference, and if it is increasing and it is protruding, reduce the weight and see that you are going to low normal BMI, and check the ultrasound scan, because ultrasound scan is not harmful. It is not like a CT scan or MRI. So it is cheap, it is very economical, and it is there's no side effects. So after 3 months, you do the lifestyle correction by the self and find out and see that it is reversed. And if you are taking medication for other things, then you have to be very careful, and you may need a support. If you are taking finding fatty liver grade 2 or 3, and you are taking medication for the diabetes, hypertension, cholesterol, heart disease, etc., then we had to get expert guidance for the to come out of the medication also. And it is very easy also. Actually, in my experience, I'm giving this clinically supported lifestyle correction. It's very easy to come out of in the early stage of the liver disease. Coming out is very easy, and also to type 2 diabetes, type hypertension, this this coronary artery disease and all. Within a month, we'll be able to come out of all the medicines, and within 3 months, the fatty liver stage will be reduced. Definitely, if the patient is following the things like correctly, the weight reduction also will be there, and the ultrasound scan, the fat reduction also will be there. And this fatty liver will be reduced to next level, lower level.
Since you mentioned that those who are having fatty liver, it is something like a systemic disease, so that it is a symptom of that, and they will be also having other diseases along with it, like diabetes and other issues. So when this patient comes for treatment, does how do the other medications affect the fatty liver or the chronic liver condition?
Usually, these chronic medications will be used for the lifestyle diseases, especially of metabolic origin, like diabetes, hypertension, heart disease, etc. Along with that, there will be definitely The fatty liver also will be there. The problem is liver is also sick. Metabolic syndrome, that is metabolism is the, liver is the center of all the metabolism. So whatever you eat, it has to be metabolized. Even the drugs, the medications you're eating also has to be metabolized. That is happening in the liver. So when the liver is sick, if you're taking even the simple medicines like painkillers like paracetamol or this statin, it has to be digested, and for the digestion it is helping, and also for metabolizing that it has to be this medication is not nutrients actually. It is actually body will be, or liver will be considering it as a toxin. So liver has to remove it. So already liver is sick and you are putting some more and more medicine. So liver will find it difficult and it will progress if you are continuing with the medicine and you are not correcting the lifestyle. And then the fatty liver grade 1 will proceed to grade 2 and grade 3, and along with that hepatitis will come. This liver function test, the SGOT, SGPT and all will go high, and it will go to stage 4, and now we have fibro scan also, so that will give the elasticity of the liver, and it will also go high in the higher level, and then go for the cirrhosis, that is fibrosis is happening, and that is called the liver cirrhosis, and the liver will start shrinking. And there will be some cases there will not be shrinking, there will be some cells will be accumulating fat, and the initial stage actually with the fat accumulation the liver will be enlarging. Then at a later stage it will start shrinking, and then the portal hypertension, this blood vomiting, ascites, there is not the albumin, that is protein which is actually keeping the blood inside the blood vessels will be reduced. So then there will be edema will be there, and the leg will be swollen with edema, this accumulated fluid, and also the tummy will be protruding with the ascites. And so it will progress like that. So we had to avoid that. So at the stage 1 fatty liver itself, we should be taken care. And it's all lifestyle disease. You have to manage it with lifestyle. And also remember that there's no medication for this fatty liver or any of these liver conditions. So only the medication is for the viral fatty hepatitis, viral hepatitis, but also the medication's role is very minimalist. There is no really effective antiviral also. So we should take care and give minimize the toxins, minimize the medications, reduce the calorie intake, and make sure that all the essential nutrients are there so that the liver can function easily. So it can liver can do its duty only if you give essential nutrients. So that we should be aware of it.
Actually, from what you said, taking medicines, generally everyone feels that taking medicines is something like that medicine goes into your stomach and then it goes to where it has to act, and then it does something. Suppose I have a pain here, maybe I take a medicine, a tablet, and the tablet, some part of it goes here and then acts there. That's what I generally think. But you are saying that, the medicines, any medicine for that matter, almost all medicines, when they are taken, they have to be acted on through the liver. So that means whatever medications you take, the liver has to work on that. Is it like that? Or is it, just a very simplified version of it? Can you explain, if you take a medicine, what does the liver do? And what is the type of strain that a liver is put to?
See, when you're taking a medicine, the first thing, it has to come into the intestine and it has to get absorbed. If you're taking a sublingual tablet for a heart pain, it will be directly absorbed from the mouth itself. Sublingual means you're applying the tablet under the tongue. So it will not directly go into the liver, but it will be absorbed into the bloodstream. So there will not be any first pass metabolism. First, if you are taking oral medications, everything is going into the liver first. It will be absorbed from that and directly going into the liver. And liver considered it's a toxin, and liver will destroy it as much as possible, 80 to 90% or 95%. It will be destroyed, and then it will be the drug part, which is 5% or 10%, which is escape the liver cells, will be going into the systemic circulation, and it will be distributed all over the body, not in a particular place. You will be taking a pain for your wrist, but the medicine is going everywhere in all the cells in the body. So that is why the medicine side effects comes. Almost every medicine, if you're taking medicine for one disease, the other may be increased. If you're taking medication for the joint pain, your heart can be affected. So many of the medications, this painkillers, has been withdrawn from the market because it is affected. It can give the heart attack risk will be high. So that is the way. So for the liver, all the medicine liver considered is a toxic, and whatever medication you take, it will be becoming a strain for the liver, and it will automatically it will support the progression of the disease.
Actually, from what I understood is the medications actually are passed through a process of the liver, at least the majority of the medications. So in general, medications create strain. So even it appears like even the best of medicines can actually be a problem for the liver if your liver is not healthy. Is it true?
Yes, definitely. If you will look into the this pamphlet or the prescription instructions, many of the medicines cannot be used for a person with liver disease. That we should almost all the medicine there will be written a specification that it should not be used for the it should be careful, or it will contraindicated for the liver patients. And definitely there will be kidney also will be there. But when we are focusing today, we are focusing on the liver. Then all the medicines there will be such instructions will be there. Even if the statin, when many of the European countries have started giving notification, because statin is many of the places it is over-the-counter medicine. So if you have fatty liver or liver problems, you should be careful about not take this over-the-counter statin. So such instructions are there. Actually, even this statin also will give a double strain. Actually, one is liver has to metabolize it. The next is it is actually the liver primary function is producing cholesterol, and this is blocking the production of the cholesterol. That will be definitely a strain for the liver.
From what you have said, if a person has a problem with the liver and then he has other problems like say diabetes or hypertension or cardiovascular issues, from what you said, the person should first get his liver right. Then only he should actually look at the other parts of it, because otherwise everything will affect it in a wrong way. So in such a case, what is your experience, because you are actually focusing on clinically supported lifestyle correction? What is your message for those who are having other diseases for which they are taking medication and then they find that they have a problem with their liver?
See, I remember one patient who was diagnosed with uh, liver fibrosis for stage 4 and a cirrhosis. And he's non-alcoholic, and it's actually he's a lean person. He's not obese or anything. But he's taking medication for the diabetes, hypertension, cholesterol, and a blood thinner for the heart disease also. So all this medicine he's taking, he's coming and telling me that, doctor, I'm not. I said we had to reverse we had to reduce the medication also. He's very insistent that he doesn't have any problem with the diabetes, hypertension, and all the. He's very comfortable with the medication. I'm bothered only about this fibrosis liver. I am worried about, doctor, only the fibrosis. I want to correct this fibrosis. So this is very common for many of the patients. Actually, they'll be okay with the medication for other things, diabetes and hypertension and all. So we had to understand that the first disease came is insulin resistance. The diabetes came first. And then along with that, when they start the anti-diabetic medicine, the hypertension came. Or maybe hypertension had come first. And actually the reason for this hypertension is accumulated fat inside the blood vessels. So the blood vessels become narrower and the heart has to pump strongly. And when the heart has to pump strongly, the heart muscles will be enlarged, and it can go into heart attack and all. So we had to correct from the base, and from this insulin resistance also playing a part in the liver, fatty liver, the initial stage. And so we had to start from the basic problem. That is lifestyle. It related the diabetes first, hypertension next. So it is a process actually. It is a metabolic syndrome. We had to correct all the aspect of the metabolic syndrome. So the most satisfying thing is we can correct all this within a month itself. this medications can be. So it's full correction. I'm not meaning about the full correction, but the diabetes, if it's a type 2 diabetes, if you are following the lifestyle correction method we are following, the first day itself we can stop the diabetic medicine. So the liver strain is reduced. Usually within 1 or 2 weeks, if it is only 1 or 2 BP medicines is there and the kidney is not failed, within 2-3 weeks the hypertension medicine can be reduced and tapered off, and the cholesterol statins can be tapered off, and everything. Actually, we do everything in this evidence based, like following with the 4 times usually in the diabetic patients, not left alone with just stopping the diabetic medicines. So 4 times blood sugar should be monitored, and it should be made that make sure that it will be between 70 to 140 even after food. 70 to 140 is the limit we keep. And also the BP has to come down to 120/80 or 130/90, and when it start reducing, and the BP, it's gradually actually, and see that the BP is controlled without medication. And the cholesterol will be checked every week, and see that this lipids will be checked, and the cholesterol and triglyceride in the normal range. So in that way, it is possible only.
One of the aspects that we went through in the previous episode was that if a person has multiple diseases and the liver has a problem, you were mentioning that the treatment, that is the conventional treatment with medications, becomes more complicated just because the liver is compromised. What you mentioned was that if the liver was compromised, the medications would not function well. So that creates a big problem. So to begin with, we also would like to know what are the general comorbidities that are associated with liver disease and fatty liver.
The most common problems, that is the most common diseases itself, lifestyle diseases. It is none of these lifestyle diseases stand alone. They'll be coming as a group, one after another. So the fatty liver patient or the person fatty liver, it will be progressed to stage 1, stage 2, or cirrhosis, or the renal liver failure. There'll be definitely other problems also, like initial stage there will be obesity, but in the liver failure, on the end stage the patient will be thin and emaciated and all. And there will be the initial stage, there will be usually diabetes, hypertension will be there, diabetes will be there, and this atherosclerosis and the dyslipidemia and atherosclerosis and the blocked vessels like coronary artery block and heart disease, and it's all going together actually. So they will be taking medication for if it is has progressed to stage 3 or 4, definitely they have been taking medication for a long time. So actually, when you are taking medication, it is actually these medications will be definitely straining the liver, and the progression to the stage 1 to 2 and 2 to 3, and even going for the failure or going into the cancer, definitely this if it is hepatitis is progressing, that is alcohol, is non-alcoholic or alcoholic steatohepatitis, that means if the liver enzyme is also high, so definitely the chance of cancer also is there. So it all will be progressing along with the this medication also. So what we had to understand, that we had to these diseases are not came because of the lack of medication. So we had to understand that it is only you are following a wrong lifestyle. That is, lifestyle means eating habits and also your activity habits, or you're taking too much of toxins like color, preservatives. We are all taste makers. We are all very attached to taste, especially with this modern food. So much of taste makers is added. We are giving importance for the taste actually. For that, we are compromising intake of toxins, which is not needed for our body. And also, we are compromising nutrition also. The nutritious food, leafy vegetables, the fresh vegetables and all will not be tasty. So we will not be avoiding that, and we are taking processed food, especially the food made of processed powders and like maida and all. So it is devoid of any much of the nutrition, only calories there. We are adding maida with sugar and salt and hydrogenated fat and baking it and making it very tasty, and adding some tastemakers, color, preservatives, etc., and make it very attractive pastry, cake. And all these bakery items. So these are actually harming us, that we have to understand.
Actually, when we talk about this comorbidities, uh, they say that diabetes creates high blood sugar, then cholesterol, high fats, then hypertension, pressure, high pressure. They say that all these three directly affect the liver. So if a patient is suffering from these related diseases, and then those diseases are directly affecting the liver, what should the patient understand?
These diseases actually not only affecting liver, blood sugar, the sugar is going everywhere through the blood vessels. The whole blood vessels is getting damaged. The hypertension, this high glucose, it is damaging the blood vessels and all the cells in our body. And also the hypertension, the pressure is increasing. Why? The blood vessel is getting narrower and the heart has to pump high. So that is also the blood pressure. High blood pressure is an indication of the this blood vessel damage actually. So high triglyceride and actually the cholesterol is not that important actually. According to the latest understanding, it is not the cholesterol is the major harm. Actually, the triglyceride has to be corrected. If the triglyceride is kept low, then the slight increase in the cholesterol or is not that harmful for the body. We have to keep the triglyceride normal without any medication. That is the most important. So if the triglyceride is normal, this accumulated fat inside the blood vessels, actually the fat is accumulating inside the blood vessels, that is actually narrowing the blood vessels and creating high BP. So this excess fat will be taken or absorbed. So that is the beauty of our body. It can even the blood vessels can repair by itself, and the liver, even it is fibrosed, the hepatocytes can multiply and regrow, and we can compensate for within. Actually, the lifespan of the liver cells is almost 1.5 years. If you are we came to stage 3 or stage 4 fibrosis and cirrhosis also. If you correct your lifestyle and take your correct nutrition, give a chance for the liver to repair. It may take 1.5 years for the full repair. But I am saying that in the coronary supported lifestyle correction, every 3 months we repeat the ultrasound scan and see it is very fast progress. I remember one person was in the stage 4 fibrosis. Actually, in the initial stage, he had fibrosis and fatty liver. The liver was enlarged. And in the third month, 90 days scan, actually his liver size is reduced. So he was worrying, which is any problem actually. So whether it is actually in that is because of the fat content is reducing, the liver size will reduce. Then in the 180 days scan, it has come to normal. And the fibrosis level is also, now the fibro scan also is there. And not only the liver size and the regular abdominal ultrasound scan, the fibro scan shows showing that the fibrosis level is reducing. Fibrosis level is reducing means there is more and more new hepatocytes are coming up. So within by the time it is almost this fibrosis stage was reduced. Fibrosis part was reducing. Fibroscan was many of the parts it was normal, and the clear improvement was there. Actually, within a year, if he's following the diet and the instructions, the liver will regrow to normal within 1 or 1.5 years. That is depends on the regeneration and the dividing capacity of the cells.
I've heard you speak about this polypharmacy as one of the major issues that is affecting liver health. So only now patients are also getting a picture about polypharmacy and all that. So what is your message on this polypharmacy? Because we are talking about these multiple disorders at the same time, polypharmacy and its effect on liver health.
Liver disease patients, there will be other diseases, definitely diabetes, hypertension, dyslipidemia, heart disease. That is the most common prescription I'm seeing. And other things, the psychiatric medicines definitely increase the weight gain, and also fatty liver will be very common. And many of the patients who are taking antipsychotic medicines will be having given statin also, because they will be having this fatty problem is there. And many patients will be this arthritis, this degenerative disease of the knee or the disc prolapse patients also will be having this excess fat, and the other problems will be there. They'll be taking painkillers, and even these rheumatism patients, they'll be taking steroids and so many medications. Methotrexate, it is a very liver toxic medicine, methotrexate. So the patients will be, see, in the modern medicine, what we are actually treating is, we are basically focusing on the symptom relief, not the root cause. Root cause, if it is an infection, we are concentrating on the root cause, like killing the germs using antibiotic, antiviral, antifungal, etc. And also we are using these vaccines for the immune strengthening. But these lifestyle diseases are of inflammatory nature. So what we are doing is suppressing. Say actually almost all the medicines we are using is to anti-inflammatory, reducing the inflammation. But the problem is in our immunity. Actually, everything in our body is controlled by the immune system. There is this inflammation is there, that is attacking. So inflammation is coming in the diabetes. Diabetes is considered as an inflammatory disease. Inflammation is coming from where? Actually, this toxin. Toxin is glucose, our own food, the rice we are eating, or the wheat we are eating, or the sugar we are taking is becoming a toxin. And that is actually creating inflammation. That is why the diabetes is called an inflammatory disease. So when we are taking anti-inflammatory medicine, when we are taking pain, actually this aspirin we are taking, it's also an anti-inflammatory. The natural tendency of the blood is to, if there is a wound, it has to clot and prevent bleeding. So what we are doing is inflammation is high, so the blood has a tendency to clot. Inflammation, too much of that is why in the COVID situation there is pulmonary, this lung vessels, the blood was getting clotted because of the high inflammatory level. Blood clotting has increased. And actually this, because of the high inflammation, the clotting is increasing. That is the reason for this, and sometimes the attack also, heart attack and the stroke and all. So this when we are taking anti-inflammatory medicine, we are actually blocking the healing aspect also. That is why in our clinically supported lifestyle correction, if you want the body to repair by itself, the anti-inflammatory part also should be strong. To make the anti-inflammatory part strong, say inflammation and anti-inflammation is controlled by this omega-3 and omega-6. Everyone knows that the omega-3 is good for health. So for the heart disease and this rheumatism and all, the people are started taking omega-3 supplements and all. See, omega-3 is actually the anti-inflammatory or healing part. The omega-6 is the inflammatory or defense part. Actually, all the medications we are using, a major part at least, is actually suppressing this inflammation. But all the medicines which is suppressing the inflammation, because it's a parallel pathway, it is suppressing the healing process also. So it is very important, if your body has to heal, to avoiding medication or tapering off the medication with the lifestyle correction. You cannot taper off medication just like that. With the lifestyle correction, you can gradually taper off all the medication so that you can this healing aspect can be promoted, that immune system can be in balance, and you can get a healing. And for even the liver problems, the healing is happening in that way.
Actually, with your extensive experience in treating lifestyle disease patients, can you give an example of how this sort of thing actually worked out when a patient came with liver disease and also multiple other disorders?
Almost 90% of the patients, they are coming, maybe 95%, they'll be having at least stage 1 fatty liver will be there. And many, if you are reached in the stage 2, there'll be this liver function test also will be high. Like this SGOT, SGPT and all will be high. So I have not treated the claim for the patient who are coming for the clinically supported lifestyle correction will be having, at least when we are looking into the blood report, it will be many abnormalities will be there. And one of it is, there can be kidney problems can be there. In this thyroid problem, this Hashimoto's thyroiditis is very common. In the ladies part, the PCOD and menstrual irregularity will be there. And of course, diabetes, hypertension, dyslipidemia is the most common. So they will be taking at least 2-3 problems will be there. Not just for, I have not seen anyone with just for this liver problem alone. Very rarely the liver problem alone is, it's definitely there will be other problems also. I don't remember any patient will have only the liver problem. So when we look, at least the overweight will be there, this excess fat will be there, and many other parameters will be also abnormal. And inflammatory and this autoimmune factors. This autoimmune hepatitis also is there. But there are two types of autoimmune hepatitis is there. One is fast progressing, but I don't get into that. No one will with liver fast progressing liver disease. I cannot the clinical supported lifestyle correction. We are usually managing the chronic problems. Chronic this hepatitis, which is those who they are not overweight, not alcoholic. Those patients, if you are getting, and even not diabetic, not hypertensive, those are patients, if you are getting liver disease or the fibrosis, which is going into fibrosis and all, it can be of autoimmune nature. All this can be, actually, even the autoimmune nature problems, and it will be definitely most of what I have understood from my experience, may not be in the medical literature. What I understand is, it is related to gut and the food we eat. Many food we eat, which is very common, like the pulses like this Bengal gram, which is very common in used food in India. It is intolerant for many. It is allergic actually. There is, I think, around 15% of the people, and some studies also, this this dalchana or the Bengal gram is not tolerant for many, because many of these food items in our routine cuisines, it is that is a major part. And even many vegetables and fruits, which is evidently healthy food, also may not be good for the person. Now we have methods, the diagnostic methods there to find out which food is reacting to you, and which is at least partially, not everything we can find out from the test, but we can. And if you are correcting that, this usually in this autoimmune disease, some of the autoimmune markers will be positive. Even the autoimmune markers will come down. The fatty liver and the hepatitis, this SGOT and SGPT will come down within few weeks itself actually. Along with this weight reduction and the cholesterol and the triglyceride reduction in the blood, this SGPT and SGOT within 2 or 3 weeks, most of the patients, if they are following it correctly, the obese person, whether the person is following it correctly, dependent on the weight reduction also. So everything will be correct and proportionate reduction will be there. And the hepatitis part, this high liver enzymes and all can be reduced very fast. And usually what all medications are taken, and most of them will be, I have seen patients with liver disease taking 20-30 tablets a day, for 2 or 3 for the diabetes, 2 or 3 for the hypertension, cholesterol, and some statin and also blood thinners, and for some bile salt supplements, and many other medications. Maybe they'll be having some psychiatric problems, anxiety, and they'll be taking for that also. And if the patient is following correctly, within a month we can come out of most of the medication at least. And that itself is a relief for the liver. And we had to come out of medication, then only we can give a chance for the liver to give an optimal atmosphere, situation for the liver cells to regenerate. So that is possible actually. There may not be much of the literature in the medical world like this, because no one is talking in the modern medicine about the lifestyle correction much, or there's not much studies about this lifestyle, how lifestyle correction is benefited. We are studying only about the this drug studies and will be there, and also the effectiveness of the drug will be studied, and also effectiveness of even the surgery. There is not much of the study actually. Only the studies are concentrating on the medications or the drugs. We are not correcting how much benefit is giving. It is not there. That is our deficiency actually.
Actually, from what we heard, the liver plays a major part in actually handling the okay. Actually, we understand that the liver plays a major part in handling the medications that are given to a patient. At the same time, if you look at liver health, if the liver's health is compromised or poor, then giving medications is actually adding to the risk and all that. So sometimes we also find that many patients who are having liver issues, they have some problems with their mental health also, cognitive decline and all that. So what is it that actually causes that, and what can be actually done about that?
See, cognitive decline will be severe in the end stage because the patient will not be able to understand what is actually the end stage of the liver disease. The patient can go into coma, and because this toxins is accumulating, and because the liver is not able to function, and the toxin is accumulating, and it is giving damage to the nervous system. That is the reason for the end stage cognitive, and the even the patient will be present as a psychiatric patient because they don't know what is, they cannot recognize even the basic cognitive function will not be there in the end stage. But in the early stage, what is happening is many of the necessary things for the brain functioning also, and even the hormones and many things is actually just the production unit of the body. Almost 500 items are produced by the liver. Even this glucose, the food what we are eating, actually it is processed. The processing of the food we are eating is happening. Food we are eating, it is absorbed into the system and going directly into the liver. The glucose, it has to be processed, and if the excess is there, it will be converted into glycogen for immediate use, and for the long-term use, it is converted into fat, and it has to be taken to the adipose cells, and such things are happening actually. Even the vitamins, minerals, actually the liver, we all take this, when we take into the very good source of vitamin B, vitamins, any of the vitamins, when we take it is actually the liver, vitamin D, the best source of liver. This animal liver is used as a nutrient, the special food for us, for many of the diseases. Even we know that cod liver oil, this one special fish liver oil is taken as the vitamin, this omega-3 supplement. So liver is the liver, most of the vitamins are concentrated in the liver. So that is why liver is taken as a healthy food for the animal. Liver is taken as a healthy food actually. So when we are eating, everything is going and concentrating in the liver, and the liver is producing and distributing. This is the kitchen. Actually, the body's kitchen is the liver, and not only the kitchen, it is the excretory organ also. So the production unit and the excretory unit. So when this liver is not producing, then we have to all the brain functions, cognitive function will be reduced, and also along with that, liver has to produce the cholesterol. Cholesterol is very essential for the cognitive function, and the cell multiplication. Cholesterol is needed. If you are taking, if you have liver disease and you are taking statin, then how the brain will get enough cholesterol? How the body can repair by itself? Then repair of the body means the damaged cell has to be replaced by the new cells. For that, the cell membrane is needed. So the body building, this cholesterol has an important role. So if you are the liver is sick, liver is the one who is making the cholesterol, and it is sick and it is not able to do its function, and you are the basic production capacity also reduced by giving statin and blocking the production. The enzyme, which is the crucial enzyme in the production of the cholesterol, is blocked. So how can you expect a good intelligence and cognitive function in that situation?
You often say that this liver and the gut health are very much connected, and so that they have to be taken together. So if you have a weak liver or compromised liver, the gut also will be compromised, and vice versa. So what is actually the way we can see both of these together?
The gut health and liver health, I can explain in an easier understanding way, this connection between the inflammatory bowel disease. Inflammatory bowel disease, like this Crohn's disease or colitis, what is happening? Actually, there is ulcers inside the bowel. So, or even in this gastric ulcers also is because of this, the ulceration will be there. And what is happening during the ulceration, and how it is liver is connected? If there is an ulcer, that means the undigested food or the bacteria inside this microbes inside the intestine can get into the bloodstream. This bacteria or viruses or what all things or undigested food, absorbed digested food is there, and undigested food and toxins also get in this. Even not only bacteria, there is endotoxins which is secreted by these bacteria and all this. Even there are worms will be there. They are all secreting so many things that also get into through this open blood vessels. The ulcer means open blood vessels will be there that can be get into easily. Actually, the barrier inside the, just like the skin is giving its barrier function from the microbes, the internal lining is giving a barrier function. But that is lost in this inflammatory bowel disease. That means that is called leaky gut, and all this gut is leaking and getting unnecessary things into the bloodstream. And where does it go? The first pass, that is going into the liver, directly going into the liver, and liver has to take all the burden out of this. So inflammatory bowel disease patients will be definitely having this fatty liver and problems. And also there is this autoimmune liver diseases that also has the connection with the gut. And this two types of autoimmune, one is this autoimmune hepatitis is there, and autoimmune cholangitis, that is the bile duct will be affected. And bile duct will be inflamed and fibrosed, and it will get blocked. And in modern medicine, actually, if the block is there, we'll try to put some stent or some mechanisms to dilate it and things like that. Actually, for that also, there's not much of medication. So in that, actually, what we have to do is to find out what is actually the problem with the gut. If the autoimmune diseases like this Crohn's disease or this ulcerative colitis or this liver autoimmune disease also, the basic problem will be lying in the gut, and there will be unnecessary things are getting into the liver, coming into the liver through the portal circulation, and that is actually the liver is trying to remove all these toxins, but it is unfortunately it is failing, and the inflammation is the damaging the liver cells itself or the liver duct, this bile duct itself, and we are going into problem. So we had to look into when the liver is actually a part of the digestive system itself. So if the liver is damaged, look into the digestive system also very closely.
So now we understand that earlier we were talking about those who are having a liver problem normally have multiple other diseases like diabetes, hypertension, and kidney disease and cardiovascular disease and all that. Now we understand that if you have a liver disease or a liver disorder, definitely the gut is also very much related. And when you are taking multiple medications for multiple diseases, not only the liver, but the gut is also very badly affected. So that is clear. So if it is like that, if a patient comes to you who is having multiple diseases and has liver disease and also a problem like you mentioned with the intestines and gut and all that, how do you see a treatment? Because can we stop all the medications together, or what is the way in which it is approached?
So we had to find out what is actually creating problem. And so for we usually look into the food habits and the activity pattern, and whether how much of toxins going in, how much of toxins are there in the body, and what is the gut health, and what is the nutritional status, and different aspect. And then we will be approaching it in a very systematic way. And usually most of the medications can be stopped within a month, not simply stopping. Gradually it can be reduced into and taper off within a month. The diabetic medicine, if it is a type 2 diabetes, it can be stopped initially itself, and we'll be following it. The blood sugar is maintained normally. So it is actually, it is very, if you know how to approach the clinical support, the patient is getting very clear clinical support, it is very easy to reverse. Only thing the patient should have the mind or they should also understand why they are taking the medicine, why it is not getting effective. They may be taking medication for the 20-25 years, but the disease is not going. But it can be simply reversed and corrected within the medications can be returned within a month. It is very difficult for the patients to understand. That is the problem actually. And we had to, the people has to understand it. They had to grow into that level of medical and health education has to change. That is the most important. The awareness has to increase. The lifestyle disease, the medication is not the answer. Lifestyle correction is the answer. They had to understand it.
When we are looking at lifestyle correction, what exactly is the difference between lifestyle correction as practiced by any individual and clinically supported lifestyle correction?
See, lifestyle correction means every individual has an understanding about lifestyle, correct lifestyle. Some may be thinking that their lifestyle is not correct and they'll try to do some exercise and reduce on calorie and all. And some are clearly saying that the person I am meeting actually, that patients itself saying, Doctor, I am doing all these things, but I have this fatty liver, I am very healthy eating, I have a healthy eating habit is there. And but I am diabetic and hypertensive and I'm taking all this medicine and now the my liver is having grade 2 or grade 3 fatty liver and fibrosis is there. So some people will say, I'm slightly foodie and lazy to do any exercise. So I know the disease, I got the disease because of my problem. So whatever be, if you are doing lifestyle correction with your own limited understanding, each person will be having a different understanding about the food and the life habits and all. If you have a disease, if you think that you are doing all the effort you are taking also, if you are having a lifestyle disease and you are on chronic medication, only for lifestyle disease we are taking chronic medication. If you get a flu, it will be the medication will be taken only for a week or so, and we will come out of it. Or if you get a sprain or any pain, if it is 1 week, it is okay. That is not, we don't count it as a lifestyle disease. But if the disease is recurring, that means if you have to take it medication continuously, that means it is a lifestyle disease. You had your lifestyle correction. If you think that you are doing lifestyle correction, or if you are thinking that you are not doing whatever you are not able to do the corrections properly. That is the meaning of that. If you are not able to come out of the medication and the disease, your lifestyle correction is not going in the correct way. In that place, the importance of the clinically supported lifestyle correction. Clinically supported lifestyle correction means the way I am following. There may be different methods following in different part of the world, in different countries. There will be doctors who may be following this clinical support and lifestyle correction. And but uh, in my clinic, the clinically supported lifestyle correction we are following, in that we follow this study the patient's body and also the blood parameters and also the necessary investigations to understand about the body and also their lifestyle, their food habits, and also the mental and physical activity, also the sleeping pattern, everything we study. Then only we start the treatment as such, and then we follow it with the regular monitoring. The blood sugar and all in 4 times a day, BP also 4 times a day, and depending on the patient's diseases we follow. And we usually initially every 8th day we come to the this uh, assessment, progress assessment directly also. So within 15 days or 30 days will be patient will be almost everything is not in the perfect because the body needs some time for the repair. So usually as a generally we according to the modern science understanding, almost 90% of the cell will be replaced in 90 days. Only the rest of the 10% will be there to for the correction next year. So within 90 days, we get a reasonable correction. So even the blood cells, that is the most number of cells in the body, is the blood cells is the most number wise. So the WBCs will be this 90 days that the immune system cells will be replaced in many times. Usually the immune system cell many of the immune system cell have only 3-4 days or maximum 1 week lifespan. But the the RBCs, the red blood cells, they have a lifespan of 3 to 4 months. So this blood cells, RBCs also will be replaced in 3 months to 4 months. So that is why the clinically supported lifestyle correction, they follow the patients very closely for the first 90 days, and then again for another 90 days till 180 days. So by the time most of the problems will be uh, there, with the reasonable settlement will be there. But when you are talking about the liver, if the initial first level 1 fatty liver or level 2 fatty liver will be most probably corrected within 180 days itself. But if it is 4 or grade 3 with fibrosis, cirrhosis and all, it will take more time. The reason is the liver cells lifespan is almost 1.5 years. So it will, the multiplication time and also will be changed. So if end stage liver disease and all, the person has to be followed up and given support and all at least for 1 or 2 years actually. But actually, even if talked like that, it is actually we are getting much of harm. The patient will usually even the. I remember a patient was advised for the transplant. Also, he is able to manage himself within 3 months itself, and with the support. But that is it. And he is advised for another 1 or 2 years also continuous follow up.
Actually, most lifestyle diseases that you treat, maybe many come together in a patient. There will be many numbers of them, but whatever it is, normally when they start, there is no pain associated. It is something like some discomforts and all that, but not pain as such. So when you come across patients who have been under treatment for say diabetes, cholesterol, hypertension, and liver problems and all that. Maybe they are having all of this together, but they don't have any pain as such. And they may only be noticing the seriousness of it during some lab tests, etc. By chance, they must have come across. So, when these patients, or which type of patients actually prefer, to go for clinically supported lifestyle correction to overcome their issues?
See, usually those who are interested in clinically supported lifestyle correction only will come to me, because when if they're contacting my staff itself or the reception itself, will give a clear direction about what is clinically supported lifestyle correction. Even it is in the website and all, it is very clearly written. If they're interested and willing only, they'll be usually coming for uh, to me. So if they are coming, we will be doing, and basically they are interested in the lifestyle correction. And usually the patients all know that if it's a liver disease, they know that usually the stage 1 and stage 2 and all will be ignored by the patient because they don't have any pain and they don't know. Usually after a scan or a health checkup, if the patient is seeing stage 2 or stage 1 fatty liver, the patient, if at all the patient, the doctor will not usually want. And I had seen that the patient, the report is there, but they don't know about the significance at all, and they had consulted their physician and all. And only with they may be coming for a fatty liver grade 1, no one comes. They may be having some other problems also. And but some patients, with more health conscious patients, may be thinking about that if they saw a result like a fatty liver 1 or 2, they will come. So there are very health conscious, very well aware of the health and very yeah, knowledgeable about the health. Maybe they will be having PhD or other things are there, but they may not be. Many will be may not be aware of the importance of fatty liver or what is the significance and all. So if they come, we'll work out and give advice. And usually 90% of the patients will be having so many other problems, especially the core, this metabolic syndrome, other part like diabetes, hypertension, heart disease, everything, and also maybe kidney also started failing. And because of that, they may have some symptoms also. And if the diabetes is there, there will be symptoms like nephropathy, neuropathy, this 4-3 urine. When they pass urine, the bubbles will be, or the frothing will be there. So such symptoms, after they will be worried and they will be coming for that. So whatever the most rewarding or the most satisfying thing as a doctor, if a lifestyle disease or one or many, if the many of the patients will be having obesity, hypertension, heart disease, and along with that fatty liver, they may be having sleep apnea and sleeping with the CPAP, or they will be having arthritis also. There may be this degeneration of the knee replacement also have been said. But all these patients, if they are willing for a lifestyle correction, if you go in the correct way, we can, even this obese patients, we can reduce around 20% of the weight within 3 months itself. So that means within, if the person is 100 kg, within 3 months he can come down to 80. That itself is not in a admission or in this nursing home thing. It's only while the patient is at home itself, they can home management. If it is a ideal situation, it is in a clinical setup. If they are staying itself, I am sure that the result will be much higher. We are not providing such a facility now, but with they are continuing working and everything. They can, if the person is healthy and a young person, they are continuing going for the work, and they can do that. That is the situation, and that is the most important thing. Everyone should understand. If they have a will, they can come out of all the medicines simultaneously. All these medications for the diabetes, hypertension, everything, most of it. With the rare situations, they may have to continue few of the medicines, like those who are on pacemaker or recently put a stent, then they have to take the blood thinners. Otherwise, most of the medications can be come out within a month or two.
Actually, when you are looking back, say 50 years back, people generally, they would avoid medicines as much as possible. So, if there is a need for medicine also, they will take it for 2 days. Then they will say, doctor, can I stop within tomorrow? I'm better or something like that. But nowadays, we find that, the number of medications patients take, especially those with lifestyle diseases, is increasing manifold. So, in such a situation, for you have mentioned earlier about how patients you meet who take 15 to 20 tablets a day. So, what happens when you say that you can reduce and sometimes avoid taking medication if you do this? If you look at this approach, do they feel shocked, or they are, I mean, what is their general feeling? And also, I'm interested in knowing that, are there people who would like to stop medications in the current world where, medications are seen as so simple and easy solution for all of our problems?
Basically, those who have some knowledge and inclination for or understanding this lifestyle disease, it is not the answer, this medication. They might have, the patients who are coming to me is having such an intelligence level. It is not the way, they don't have to be very high of education and all. They may be just school final or the SSLC or school, basic school education, or even less than that with the, but they're intelligent enough to understand. And most of them are coming after watching this sort of videos, and they feel that it is possible after, uh, or they may be searching for their problem and then say I'm popping up the video, or going into the, then they actually come after studying, and then only they are coming. And next to another sort of patients is actually the family members. Usually this videos, and they are coming after, or after so much of research only they will be usually coming. And then the family members. Actually, I have same family. The one person is getting out of the diabetes and other problems. They will bring the other patient, and their brother or sister or husband, and they're saying that the patients actually is the most disappointment for the patient. They are actually finding out it is, and they are experiencing it. But then they say to the friends and family, they are not believing it, or even if the person they got the result, they believe it, but they are not willing for the correction. They just want to go take the medicine, and that is actually the patient itself is so depressed about. They are not able to motivate the others for the, even though they believe that they know that he got or she got the result. That is because the lifestyle correction is actually the patient or the people are finding it very difficult. That is not difficult. That you had to come into that understanding. Mainly the people are not understanding the side effects of the medication because it is so freely used. So the side effects, because every doctor will be promoting the patients to take the medication regularly. So it is true also, because if you take antihypertensive or medication with the regular interval, it can shoot up the blood pressure. Even there can be rebound shooting up of the blood BP, and give a hemorrhagic stroke. So even one dose of diabetic medicine or the insulin injection is not taken, the blood sugar will go shooting up. So that is the situation. If the painkillers, if you are not taken at one single day, that after it will be having maximum or 8 or 12 or maximum 24 hours, any medicine, usually. So if the time period is over, you will get the symptoms back. So actually, it's only 100 years we are, this modern medicine is, this pharmaceutical medicine is in the increase. That is, I think in the 1925 it started. This hike in the medication and the pharmaceutical discoveries and all. So, but the last 50 years, during the last 50 years, we understand that so much of medicines is there, but none of these lifestyle diseases is getting corrected. And actually, it is going further and further, and the liver is getting damaged. If a diabetic patient or the hypertensive patient, liver getting damaged, kidney getting damaged, and it is a progressive problem. So actually, I'm in the medical profession for the last 40 plus years. And I am also saying that I understood that it is not a solution for, there is none of the this diseases. Actually, the medications, 90% of the medication is taken for this lifestyle disease. How can a lifestyle disease be corrected without correcting the lifestyle? So if you are taking the medication, it is very difficult, especially the diabetic medications we are taking, it is very difficult to control your diet itself. Because if you are taking hypoglycemic medicine like insulin and skipping food, you will get a hypoglycemia and all sort of discomforts. So the person will be eating more. So that is the reason for the progress. So the people has to understand that. So we are going in the wrong direction in the healthcare. I felt like that. That is the reason for this developing a protocol for lifestyle correction. And that is working. It is very clearly, and it is evidence based, because we are doing all the tests, and it's much more meticulously, not in the Like the modern medicine, which when the medicine is used, we are using actually much more meticulous follow-up also.
You always say that the patient who gets into this clinically supported lifestyle correction format for treating lifestyle diseases, they change over from being a passive patient to becoming an active patient, and then only that improvement starts. Uh, how do you see that many patients, for that matter, almost most patients, they like to remain passive. Means they are just normally they are told you should watch your weight, or you should watch your BP, or you should watch your liver health. So they prefer to keep watching and let the others do what is needed. So you are saying that such patients who are willing to just keep watching are not suited for this. They have to be more active. Means they have to take initiative and all that. So if it is like that, do you see any particular traits in these patients that who choose this format? In the way they approach treatment itself.
See, the patients who is having basic understanding of the health and also having a reasonable intelligence. It is not the education. It's whether they are actually the the doctors or medical professionals, not immaterial. And those who have a basic, they should be able to understand that too. They should themselves ask questions like, I'm taking all this medicine for this many years, but I am not getting any, my disease is not getting corrected. Why? The person itself should ask. And they know, they should understand that now, previously, when 40 years back, we were not understanding that this diabetes is a lifestyle disease, or the hypertension is we were not knowing what is the reason. So we were in darkness actually. But now we are very clearly, even WHO's list of lifestyle diseases, all these diseases are there. Then how can a lifestyle disease be cured or reversed or corrected? By medication. That is, so last 50 years or 100 years of experience in the modern medicine itself is showing very clearly. But a person who's able to ask such questions and find out the answer only will be suited for this. And also the understanding about what is the correct body weight, that is also very important. The people has a very wrong impression that everyone is thinking that the BMI 25, that is the upper normal, is the normal. Actually, it is not like that, because our lifestyle is sedentary lifestyle. In the sedentary lifestyle, the low normal BMI should be the it should be kept, especially if you have a disease. So such understanding they had to develop by themselves. Then only they will be suited for this lifestyle correction. And there are some patients coming and asking, Doctor, I don't want to make any change in the lifestyle food habits. I want to take all the thing. I am not interested to, or someone will say that I am not interested to do any exercise. Actually, in this pattern of exercise, there is even those who are having this arthritis and all, they can do. They can. What we are teaching them is the thing which can be lying down in the bed, and also the sitting or lying down in the just everything can be. They don't have to even walk also, because those who are having any problem also can do this. So if they not willing for any exercise and not making any correction in the lifestyle, they're not fit at all. Well, frankly speaking, then cannot be done anything. You had to do, then only you will get the result. So that is it. If the person who's having some intelligence should be there, They'll be asking self-questions, why I am not getting it corrected, what is the reason, and willing for the correction.
Actually, the patient, or at least the patient's support person, should be able to understand exactly how and why he got that disorder or disease.
Basically, the understanding, as you said, the understanding of the family members also is very important. The patient may be getting a very good idea after seeing all the videos and searching the web and everything. But the family members, if the 70-year-old father want to do the correction, their advice for a bypass or a major surgery, but the children will not allow, because they are not learned. He may be saying, understanding it, studying it for a long time. Then only the person will be understanding. And but the other family members, they don't know anything about it, and they will object. And also in the reverse also, the child, the son or daughter will be learning about it and trying to understand the parents. But the other family members and the parents may be overaged, and they may not be having that much of the cognitive power, and they will not be able to understand. But the other siblings, which are, they are not aware of it, they will seek the clear road. That is the common pathway, like going for the other modern, maybe taking, continuing with the medication. So that is the difficulty. So I think that awareness, when the people will start understanding it, and the awareness will be increased, and then the problems can be solved.
That people come from faraway places also for this treatment, clinically supported lifestyle correction. But what happens if a patient having liver problems and associated issues, they are from a distance? How do they actually get them the benefits?
See, I can tell you an example of a person who is in the middle of India, actually. It's in the northern state, actually. Now we are in the Kochi, I'm practicing, is in the southern part of India. It is miles away in the, I think, in the Andhra or that area, actually. He was actually advised to have a liver transplant. And he was booked for in a hospital at, I think, in the Hyderabad or some hospital. He has been given a booking for the liver transplant. And the hospital was asking, actually after, in between he came and he had tried some Ayurveda and also, and he came into Kerala. Basically he's a Keralite also. He has some connection with Kerala. So he came to Cochin, and anyway he's posted for a liver transplant. But what I saw is he's healthy, and he's able to travel from this Hyderabad or Andhra Pradesh. He's able to travel by himself, and he looks okay. He's not decompensated liver disease patient. And we did a detailed analysis on his liver enzymes, and many of these autoimmune antibodies also said actually his problem is autoimmune liver disease. And now I think he's almost a year. And on the 15th day, again, after starting at 8th day, 15th day, 30th day, they'll come. And in the 15th day, he again asked me, Doctor, the hospital people has called for the donor is ready. Are you coming? So I told him that you can decide whether, because the liver transplant is a major surgery. Even it is successful, because the liver, kidney transplant is comparatively a minor surgery. Comparative, the transplant surgery. Even cornea is the most easiest, the kidney is okay. In the liver, you have to remove the liver and putting a new one. And the liver is having so many enzymes and so many proteins are expressed. So the rejection possibility will be very high. And also the donor also will be having, if the relatives is the donor is also having a very high risk compared to the kidney problem, kidney transplant, kidney donation. So we had to understand that. So now he's now having no problem, but after the operation, what will be his situation? We cannot, whether it is, if it is rejected, it is the end of the life, if the rejection, or even if it is successful also, immediate success is also, the rejection, delayed rejection can come. And also the patient has to take a very heavy dose of immunosuppressants all through the life, and it can give him the chance of life expectancy can be reduced because of that steroids and this anti-inflammatory immunosuppressive agents like weight gain, diabetes, getting all these diseases because of these side effects. And also this medication itself can fail the transplanted liver also, because this is also has to be managed by the liver. So this person actually, he understood it, and he didn't go for the surgery transplant. Now it's almost 10 years. He's healthy and he's managing. It's very well. That is the thing. Even those, if the patient is having clinically stable patients with renal liver failure, advice for a liver transplant also can come out of it. And it's usually from, even I get patients from the other countries, in other continents like USA. There are so many Malayalis in the USA, basically Indian origin people mainly coming, and because they have a base here, they're even within a month they can, almost all the patients we ask for, if they are coming abroad within India, they can come and go. It's not a problem. But if it is distant, it's always better, because to stay here 1 month and settle things up, and then you can go and follow up over the telemedicine, and come down once in a while. It's according to the patient's sickness base and or the condition, they may have to come for the follow-up also, or we can do the telemedicine follow-up.
Now we have got a good picture on liver diseases and where the responsibility lies as far as the patient and the patient's caregivers are concerned about treatment and what they should know about liver health and what damages the liver and what supports the liver. And most importantly, the importance of all the other comorbidities and other diseases and their interaction with liver health, so that the treatment can be done in the most optimized way. With this, we come to the end of the last episode of our series on chronic liver disease and fatty liver. Thank you. The informed patient is key to treatment success.